think the important context for this, of course, is that organisations should have their well-being and mental health strategy. So we should know about sources of support available, whether that's the employee assistance programme, whether that's mental health first aiders, whether that's people within the people team that people can go help to. So that sort of wider context will be really important. But if we as individuals believe that somebody is struggling, we don't have to be an expert. That's the first thing to say. We can all check in with each other and say, are you okay? Or, I've noticed that X, Y, and Z has happened over the last few days. Is there anything that we should be worried about, or do you need any support? And that's exactly what we train mental health first aiders to do, to recognise the signs and symptoms, and to know how to signpost to sources of support. But you don't have to be a professional, you don't have to be an expert. It's that ability to just recognise and then to be willing to really ask the question and want to make sure that you're ready to listen. Don't want to problem solve for them, just want to listen and help somebody to identify what they need to do. But of course, that means being in the right place at the right time, having enough time, checking again if you're really unsure and say, no, I'm absolutely fine, but your tummy tells you differently, saying, I know that you said you're fine, and but I'm really, just a bit worried about this. We've got some talking tips, which we've published, and again, which we'll make sure, are linked into this. But a culture at work in which a culture in society, but one which is there in work, in which we get better at listening to our gut instinct if we believe that something's wrong, and then being willing to ask the question. And if we're still not sure, then you ask the question again, and to make sure we've got time to listen to the answer. I think we're a little bit glib sometimes, aren't we? We say, how are you, as a form of greeting rather than as a curious question. Or we want to solve people's problems, or we don't want to feel people in pain. And actually, sometimes people say, well, I didn't want to ask because I didn't want to cause pain. But if people are hurting, actually talking can become a source of relief, a way of a first step to getting further help and support. I guess just the last thing just to say in that is, of course, I said at the beginning, we don't need to be experts. It is about signposting. So the Samaritans, give us a shout, there'll be the employee assistance programme, but just being in an ability to say, it feels like you might need some help. Let's find out where you could get that together. Can be just that handhold, the metaphorical handhold that people need in order to be able to take that first step.
Yeah, valuable, really valuable lesson there. And I think it's true in so many things in life that sometimes we just need to listen. That's all that some people need is just an ear. A lot of us feel like we're rescuers, like you said, and we need to know the answer. And sometimes you just don't need that. Sometimes you just need to be present with the person and therefore be aware, I guess, that if the person then does start to open up to you, that you haven't then got a work call or something that is actually requiring your time and then saying, I really do want to have this conversation with you. Can we catch up at lunchtime? Can we go for a walk? Somewhere neutral, somewhere away from the workplace space that's confidential. Just to still give them the option to talk to you, and know that you are genuine in your inquiries as to their health. And
absolutely, and I think just to add to that, a reminder that we've got 2 ears and 1 mouth, and if we use those in proportion in this, that's always the way. And sometimes we're so desperate to say, I know, I understand, that we say, oh, I remember that, or and it may not feel significant, or it may feel overwhelming to us as individuals. But if somebody has trusted you to open up, our job then is to listen and just to provide a safe space in order to hold that, and then to help them to work out what the next step is and signpost as appropriate.